you've heard this program saves money, but how does it impact you and how you're going to be treated at the hospital?
WMAR 2 News' Mallory Safaste spoke with a researcher who's been studying the program's effects. She joins us now. So, Mallory, what exactly will patients see from this?
Well, so the program is supposed to bring down health care costs, and if that's the case, then patients should be paying less, right? Well, not necessarily. Potentially in the long term. The program's impact on emergency department wait times is also up in the air. Maryland currently has the longest ER wait times in the country. Since the 70s, the state has had an all-payer system where all patients, regardless of insurance, are billed the same amount for a service. But then in 2014, a cap was created, setting a limit on how much a hospital would be reimbursed for those services.
The thought is that if hospitals receive a fixed amount of money for all patients they serve in a given year, they have incentives to be more efficient, to avoid potentially to avoid hospitalizations that may be unnecessary, and to improve the provision of primary care for patients in the state.
Eric Roberts and a team of researchers set out to test that hypothesis. They found some improvements, reductions in readmissions, but not in emergency department visits. And right now, Maryland's ED wait time is at 50 minutes, the longest in the nation. Puerto Rico is second with 44, D.C. and Delaware tied for third with a 38-minute wait. While the problem hasn't dramatically improved here, the hope is that it will eventually under this program.
Previously, when hospitals were billing on a fee-for-service basis, they got paid each time you went to the ED, and so they didn't have an incentive to keep patients out of the ED or in any other hospital facility. Now they do.
The idea is to connect you with the right provider, the right medications, and look at your overall care plan. So it may take a little more time, but it should help eliminate frequent flyers.
So over time, the hope is that consumers will experience better care coordination, and that hospitals and physicians will be further incentivized to treat patients proactively in settings in the community that are lower cost.
And while there are projected cost savings for the state, there are not for patients, at least not right now.
If providers are becoming more efficient in saving money, your premium won't go up as much next year. So in the long term, there could be savings that patients realize. It's not going to be lower premiums in an absolute sense, but a slower rate of growth in their health insurance premiums.
So the program's overall success is still yet to be determined. It takes time to connect people in the ER with the right people in the community. But the point of the program is to foster this kind of collaboration. And if it works, we will hopefully see improvements in efficiency and quality that makes healthcare more affordable.